Hello everyone, welcome back to Kujus Media. Today I'll be talking about gout. So I'll be talking about the causes of gout,
Welcome to Kunjus Media.
the symptoms, the risk factors and the complications associated with gout. So what's gout? So gout is a common and complex form of arthritis that can affect anyone. So it's usually characterized by sudden and severe attacks of pain, swelling, redness, tenderness in one or more joints, and most often it occurs in the big toe that we have. So it can happen at any time, and you have a burning sensation on your toe that's affected. And the affected joint, like I said, will be hot and swollen and will be so tender that even the weight of your bed sheet or any light objects also seem intolerable to you. So this is how it basically gout affects. And let's move on to the causes now. Now let's talk about the causes of gout. Usually gout is caused when there is accumulation of uric acid crystals, or to be very specific, monosodium urate crystals accumulate in your joint. So what happens is, as you all know, our body has purines and pyrimidines. During the catabolism of these nucleotides, uric acid is produced. Usually this uric acid is excreted through our kidney in the form of urine or any other waste. Sometimes our body produces too much uric acid such that it cannot pass out of our body, and it enters our blood directly, and in the blood it forms needle-like urate crystals and begins surrounding our joints. So this causes inflammation and swelling around the joints and causes pain, and this we call as gout. So this is how gout is caused. Now talking about the signs and symptoms of gout. So usually the signs and symptoms of gout almost always occur suddenly and often at night, and they may be like intense joint pain. It usually affects, like I said, it usually affects your big toe, but it can occur at any joint. We are not sure where it occurs exactly, but big toe is usually the part which gets affected by gout. So other commonly affected joints may be ankles, knees, elbows, and even fingers also. So the pain is likely to be most severe within the first 4 to 24 hours actually. After the pain begins, it is more severe from first 4 to 12 hours. So this is the most common symptom of gout. The next common symptom is inflammation and redness. As I said earlier, gout is usually characterized by inflammation and redness that occurs around your joint. So the affected joint or joints becomes swollen, tender, red and warm. So this is one of the common symptom that a person experiences when affected by gout. The next is, of course, when there is inflammation, your motion is always limited. So limited range of motion is another symptom that a person experiences. So as the gout progresses, a person may not be able to move his or her joints normally as they used to do before. And finally, it's discomfort. So after most severe pain that occurs after some joint discomfort, it may last from few days to few weeks, and later attacks are likely to last longer and affect more of the joints. So yeah, these are the common signs and symptoms of gout. On to the risk factors. See, you're more likely to develop gout if you have high levels of uric acid in your body, and there are certain factors that can increase the uric acid level. So those factors may be either in your diet. So if you eat, if you frequently eat diet which is rich in red meat and shellfish, and you drink beverages which are sweetened with fruit sugar or fructose, what we call, they can increase the levels of uric acid in your body, and which in turn increases your risk of gout. And they also say, alcohol consumption, especially of beer, can also increase the risk of gout. Then next factor is weight. If you are an overweight person, your body produces more uric acid, which makes it difficult for your kidneys to filter them out, and therefore uric acid gets accumulated in your body and you have a chance of developing gout. The next factor is age and sex. See, it's usually more likely to develop in men rather than in women, because usually women have lower levels of uric acid in their body. But when a woman reaches menopause, or when a woman reaches menopause, of course their uric acid level also matches to that of men, and they also have the risk of developing gout. But usually in men, gout occurs in the age between 30 to 50, and in women after their menopause, because in women after menopause the uric acid crystals begin to develop in a higher level. So, and finally, certain presence of other diseases like blood pressure, heart diseases, kidney diseases. All these can contribute to increase in uric acid level and in turn increase the risk of gout. So these are the risk factors that's associated with gout. Moving on to the complications. So people with gout can develop more severe conditions like recurrent gout. Some people may never experience gout, signs and symptoms of gout, but others may experience it several times each year. So certain medications may help prevent gout attacks in people with recurrent gout. So if left untreated, gout can cause erosion and destruction of joint. That's it. So that's called as recurrent gout. And next is kidney stones. When the uric acid crystals begin accumulating, often in more quantity, they can lead to kidney stones and causing your kidney to damage. Then finally, it's advanced gout. So untreated gout may cause deposits of uric acid crystals in the joints, and it can lead to more severe condition than the previous one, and that's called as advanced gout. So these are the complications that's associated with gout. So that's it. Hope you all liked the video. If you did, do give a like, do share, and do subscribe to our channel. And thank you so much for watching. See you all in my next video. Bye. Take care.
Please do like, share, and subscribe the channel.